As COVID numbers continue to surge, so does the demand for COVID testing. People want to know. State Department of Health today answered questions about why people are having a hard time finding those tests. And 10 on your side, Stephanie Hudson has the answer and also what you can do about it, Steph.
Yeah, Anita, there are several factors fueling the surge in demand for those COVID tests right now. The first of which is the explosion in cases brought on by the very contagious Omicron variant during holiday travel and gatherings. Dr. Laurie Furlano discussed all of the issues during a telephone news conference this morning, and one thing she said in particular might surprise you.
Anyone who stood in one of these long lines for testing, found empty shelves in stores, or couldn't find an appointment online may find this statement hard to believe.
VDH and Virginia in general has an adequate supply of PCR testing on hand, and we have sufficient laboratory capacity.
What they don't have, Dr. Laurie Furlano told us, are enough rapid tests, which is what most people would prefer.
We placed orders that have still not been fulfilled in total. Some of those orders were weeks or months ago.
That supply chain issue is forcing more people to seek PCR tests, which she says are mostly offered in private doctor's offices and clinics.
It is possible that some healthcare providers may reserve that testing for people who have symptoms or more serious illness or those who have been exposed.
Some healthcare providers are also short-staffed with workers themselves sick or exposed to COVID. That, I'm told, is what happened in Norfolk yesterday when they had to cut the line at Military Circle off at 500 people. Reinforcements were later sent in and 700 tests total were given. VDH is now working with local health departments to increase community testing. There are 51 scheduled this week, up from 30 in prior weeks. Meantime, Furlano warns that rapid tests may continue to be in short supply for some time. So VDH is asking the public,
if you're able to find the at-home test kits, that you secure those test kits based on your immediate needs rather than keeping a lot of extras on hand.
Now, while most would prefer, of course, those rapid tests, Dr. Furlano said, take the PCR test if you can, or maybe you don't need to test at all. I'll have who should get tested and when coming up at 6.